Now we move on to treatments. So, the prevention of motion sickness is key because you want to avoid dealing with the aftermath of the symptoms. So, patients should learn what situations can cause their motion sickness and practice different tactics, behavioral, drug therapy, alternative forms of treatment to avoid or limit their symptoms of motion sickness. And that also includes, having a clear state of mind and practicing positive mental activities. So, first, I'm going to be discussing behavioral tactics to prevent motion sickness. So, there are four tactics: minimize vestibular motion, adjust to motion, synchronize visual system, and most importantly, having physical and mental comfort. So, first, minimizing vestibular motion. So, you want to avoid complex motions, which are worse than simple motions. Going on a tilt-a-whirl versus riding a car can be much different. So, that brings me to my next point. Rotating circular motions are worse than linear motions. And you want to avoid travel in difficult conditions and areas such as air travel in storms, terrain travel with many turns, accelerations, and ups and downs, and water travel in storms and large waves. Now, sometimes traveling in these conditions can be inevitable, but you know, usually it's not common to travel in these conditions. But also making sure to choose locations and vehicles that minimize motion uh, is imperative. So, over the wing of an airplane, the seat on the sides are better. And then the automobile, drivers or front passenger seat facing forward, like I've mentioned, is very important. You don't want to be looking down. And then boats facing towards the waves near the surface of the water, and then buses towards the front, lowest level facing forward. This includes trains too, with two levels. Some trains they have seats that face against the direction that you're going. What you want to do is make sure you choose a seat that's facing forward so you're moving within the direction of the motion that you're going. So your brain can make sense of it instead of, sitting the other way and or in the opposite direction and making yourself sick. So then adjusting to motion, just gradually increasing the motion stimuli, and that helps you to adjust to the exposure of the motion. And then if you're starting to get very sick or, not feeling too great, it's good to attempt to reduce the motion, but not completely if you're experiencing motion sickness, because then that requires a big adjustment for your brain. Next is synchronizing your visual system. So avoid looking at electronics or reading. I cannot stress this enough because you have to avoid spaces where the horizon can't be seen. If you're looking down, you're not seeing the horizon and therefore you're not experiencing the motion. So it's important to maintain a wide view. But if you're unable to do this, if you're somewhere where you can't look out at a window and focus on a distant point, just close your eyes and hold the head still. And you have to look towards the motion or the direction of travel to ensure that you won't get as motion sick. And of course, physical and mental comfort. Avoiding alcoholic beverages, eating before travel, but lightly. You want to avoid an empty stomach, but you don't want to have too full of a stomach in case, you know, emesis occurs. And then you want adequate sleep, hydration, adequate ventilation, of course, avoiding any noxious stimuli, and mindful breathing. That's why your Apple Watch always reminds you that you need to breathe, because just breathing for, a minute can help you feel so good and rejuvenated.